Good evening, everybody. My name is Halima Begum. I'm the director of the Runnymede Trust, and it's my absolute pleasure to invite you here this evening to a roundtable on air pollution and communities of colour. Not that popular an event usually. You go to seminars around air pollution or the environment, but getting the air pollution debate together with communities of colour is what we're focused on tonight. So welcome to this evening's event. This event was supported by UK 100, who are here with us, and Airly, and the All-Party Parliamentary Group on Air Pollution. So thank you to you all for your support. UK 100 works on clean air, is also supported by the Clean Air Fund and the European Climate Foundation. Sorry, I sound like an air hostess, but you know what I mean. I need to say thank you to our supporters before we get into the dynamic discussion of the day. So thank you to all our supporters and funders. Air quality and communities of colour. It's an incredibly topical issue for us all. We've got lots of audiences, people in the audience who are engaged on the kind of climate front and others who are engaged on the racial justice front. It's very rare to get those two constituencies together. So I'm so pleased to be hosting this discussion and looking forward to contributions from a fantastic panel that we have ahead for you. I'm going to introduce the panel. We're going to go into a conversation after we've heard from them. So the first speaker we have is Rosamund Kissi-Debrah, and I think we've all heard about Rosamund's campaigning recently following the tragic death of her daughter Ella. Rosamund, we are so delighted to have you here. The campaign comes from a lot of pain, but it also energizes us, and we look forward to hearing from you.
I think the mayor is going first.
That's true, but we're shining the light on Ella's death and the campaign around it. So I'm just going to introduce you all first, and then we're going to go to the Mayor of Bristol. Yeah.
Thank you very much for having me this evening, everyone. And I look forward to an evening of lively debates and talking about a fair range of topics as environmental justice. So thank you very much.
Thank you, Rosamund. We've also got, as you said, Mayor Marvin Rees from Bristol. Do you want to say hello, Marvin?
Sure. Hello. How are you?
Okay.
Thanks for having me on the panel.
Absolute pleasure. So we have Bristol represented, and we've got Mayor Rokhsana Fiaz. And is she here with us yet, or? Not yet, but we've definitely got Rokhsana with us, and she's sort of representing inner city Newham in London. We've also got Nadia Whittome and Labour MP for Nottingham East. Really pleased to have you, Nadia, with us, elected in 2019. Would you like to say hello?
It's a real pleasure to be here. Thanks so much, Halima.
Really, really pleased to have you here. And we've got Councillor Waseem Zaffar, MB from Birmingham City Council. Hi, Waseem, would you like to say hello?
Hello, Halima. Good evening to everybody.
Really great, thank you. So we've done our best to get speakers who would represent, you know, a wide sense of the country, the geography, the issues, both lived experience, political leadership, what it all takes to get accountability for better climate outcomes and better outcomes for our BME communities who are disproportionately affected by climate change, air pollution, and environmental degradation in general. But the focus is on air pollution in particular for today. And so I'd like to be able to pass over to Marvin first for a few introductory remarks on this issue.
Thanks very much. So just by way of introducing it, Bristol would be similar to many cities across the UK and across the world. We face the challenge of rapid urbanisation, a growing population, you know, and an economic model that in and of itself drives movement and depends on systems that pump out pollution and has an impact on climate and air quality. You know, the results in Bristol are well known now within the city. They haven't always been well known, but we estimate about 300 deaths a year, which in and of themselves are always personal tragedies. And then there was a really interesting comment made in a talk about local government finance, and it says the future will not be affordable unless we change today. And so we know the impact that has on our health services, on not just life expectancy, but one of the more stinging measures is healthy years life expectancy, the age at which people expect to become unwell to the point of being unable to work, with all implications that has for families becoming carers. So you have the overt numbers of deaths, and you have the long-term health conditions that result from that. Bristol's on the receiving end of that. In the city, the pollutants in the air, in terms of air quality, are primarily from private diesel cars, followed by buses and freight and lorries and petrol cars and taxis after that. So we know it's a real challenge. If I can just say, in response to that, partly it's a result of decades of the country's failure to deliver. We have no mass transit system to the extent that transport is a key driver of that. That's decades of a failure to deliver a meaningful alternative to private cars and a meaningful, a quality public transport system. And as is ever, when you avoid taking small actions early, you end up taking big actions later. We are at pains, so we want the kind of scale of investment we need. I've said many times, if you just put up another league table of what cities have done excellently, that's of limited value, because you're showing us stuff that I'm going to end up saying, well, how much did that cost? A mass transit system costs over £4 billion. So the action we need to take don't come free. So we need to, and I would say in this area of COVID, when we need to get the economy moving again, what it necessitates is government front-loading investment in green infrastructure, mass transit, decarbonising our waste systems, our energy systems, and all the rest of it. There's lots of jobs in it, and it makes sure that the very basis of the economic model that kicks into gear when the economy does start picking up again is one that doesn't kill people, and the planet. I'd also just say that there needs to be an overlap between the action we take on air quality and social justice. I had a lot of people just talking about just charge people. Well, we need to realize that sometimes good things can have negative consequences for some people. Low-income people will be disproportionately hit by a charging regime. So it may mean that you do have to introduce charging, but you also have to accompany it with the support mechanisms to help people transition. Taxi drivers ain't just going to go out and switch from a diesel to an electric or a gas when they're amongst the lowest paid and precariously paid people in the city. So it needs to be part of a comprehensive, multi-dimensional package if we're going to, realise the benefits that we'd like to see.
Thank you, Marvin, and thanks for that excellent introduction from Bristol. But as you say, Bristol shares a lot of things in common with other cities in getting that piece right on systems, but linking up to actions, investment, and for us not forgetting social justice. And I think you ended on quite an important point there around the way in which we bring on our communities, our low-income households and families onto the agenda. We've not really succeeded in doing that in the environmental movement, and hopefully we'll hear more about that from the rest of today. So thank you for that. So with that, we're going to now pass over to Rosamund, because it's a good time to kind of talk a little bit about the impacts on us as families and our lives and what has happened so far, Rosamund. So over to you.
There is no doubt, there is numerous research about the impact of air pollution on health. We had a break during the first lockdown where no child in the United Kingdom died for a change from asthma. Asthma is the #1 childhood disease in this country. It affects 1.1 million children. And overall, including adults, it affects 5.4 million children. 5.4 million people. In the UK, every 3 minutes, 3 people die from asthma, and 2 of those deaths shouldn't really happen. There's been numerous research about the impact of air pollution on health, and yet still there's not enough urgency for it. I hear excuses. It's the #1 reason why children miss school in this country before the pandemic, asthma. And so much more had to be done. Lots of people, or a few people will know my story, how my daughter suddenly became ill and passed away in 2013. She was one of 26. So there were 25 other families that went through something similar to us. Living with those people, I do admit Ella's asthma was extreme. However, there are children up and down the country who continue to suffer. And especially what the inquest showed us was families who live on or near busy roads are those most affected. We also know that people from the Black and South Asian community, I'm saying that specifically because it depends who's listening. When I say the Asian community, people might include other people. So I mean Bangladeshi, Pakistan, Sri Lankan, that's the group I'm actually referring to. And I'm being very specific. Over the last 10 years, not only has asthma not gone down, but we also have the worst rate in the age group 13 to 15 for asthma deaths. Now, I don't know the figure for the overall country, but in London, every year between 8 to 12 children die from asthma, and those numbers haven't changed. And if we continue, sadly, the way we are going, I don't think they're going to get any better. And that's a concern of mine. Children missing school. There are lots of promises. For instance, I need to bring up buses and diesel and the electrification of buses. It is incredibly slow. What's happening? One of the things I actually realized, I had a private meeting with the Secretary of State for today, and I don't think the emergency of asthma attacks and children suffering every day has really got through to people. People being exposed to air pollution every day. If you already have asthma and you live in an area of high air pollution, you are suffering. And I don't think that message has actually got through. People act as if we've got time. We don't have time because children are continuing to actually die. They are spread all over the country. So therefore we don't, the only time we get to see it is when there's an inquest and it suddenly comes into the newspaper, which is not acceptable. I can give an example of where I live in Lewisham, and I think 2018, we had the second highest rate for hospital admissions to do with asthma. So what that tells me is my daughter wasn't the only one. Yes, she was incredibly rare, but there are lots of other children who are also affected. And I want decision makers to have this in mind when they're planning things. Do not push traffic on roads that are already busy and families are already suffering. It is only going to make it worse. All that's going to happen is more children will be admitted to hospital, or those children that are very ill who are already suffering will end up in hospital. So I would kindly like to this evening for the decision makers and the planners, that's not my role, they design things, to actually bear that in mind. Because we had a quiet period during lockdown where we all got clean air and we were told we were going to build back greener and better. And unfortunately, I kept on warning that the pollution is very high, and I don't think people took it in. And the reason I make a point of saying it specifically is there is a link between COVID deaths and air pollution. Areas of high air pollution have more COVID deaths, and people need to look around the country at the moment at the hotspots and what's going on there regarding air pollution. And I would like to end it on that note. Thank you very much.
Thank you, Rosamund. It's just a real privilege to have you here, because what you bring is obviously the experience of trying to get the decision makers to listen, but in a way your voice carries so much for us, because it just shows in one clear example how the planning, the politics, the local authorities all need to work together. And what you've just shown now is the fact that even during a pandemic, where we've said previously, it's impossible to stop or slow down the economy or stop the planning or the building, but it all stopped, didn't it? And suddenly we realized a different way is possible. Well, if it is possible, why don't we try and reimagine, rebuild, recover in a different way? So I think it's really important thinking for later on in a discussion to think about when previously we've been told it's not possible. Well, it has been possible. We can slow down. So how can we protect our children better? And that thought that you had, which was children are dying from asthma. Why won't we take it seriously? They can't champion their own rights in the same way? Why are we ignoring this statistic and fact and the research? So we'll come back to that, hopefully.
Yeah, I mean, it's something. I think I had a real rude awakening on Monday during the 6 o'clock news. My son, who's sitting opposite me here, we were watching the 6 o'clock news, and I think it was Hugh who was doing a report about ICU, and I suddenly had this moment, which happens to me sometimes, of realizing how ill the people were, and they actually reminded me of my daughter. They had, obviously she didn't have a virus, but they were ventilated, or the tubes, or I just had this moment and I could see tears rolling. They just reminded me of that. So there is definitely a link somewhere between air pollution and COVID. But until we clean up the air, this is just going to keep on going round and round and round and round.
Absolutely. So, and overexposure being that theme, really, whether it's overexposure to COVID, overexposure to very toxic air pollution, or overexposure to badly built roads because the schools are being built in places they shouldn't be, for example, in inner city areas. But let's come back to that. Thank you very much for elaborating on that. Let's go to Mayor Rokhsana. Fiaz, I think you're with us now. Thank you for joining us. And for those of you who also maybe just joined us, Rokhsana Fiaz is the Mayor of Newham, which is a borough in London. And before I pass over to you, Rokhsana, I just wanted to say that I should have said it at the beginning. We are being recorded, so parts of this recording will be made available for more awareness raising later. So Rokhsana, over to you. Thank you for joining us. Could you maybe for 3 to 4 minutes speak to the issue around air pollution and communities of colour? And you come from Newham, so there's a lot of engagement in Newham around this campaign at the moment.
Absolutely, and a lot of challenges as well. Look, firstly, I just want to convey my heartfelt sorrow, sadness, Rosamund, for what happened to Ella, but also commend and salute you for your unstinting advocacy on this issue on behalf of her and thousands of other kids up and down the country that are blighted by the issue of polluting air that has a profound health impact on their well-being. And in the context of Newham borough that I represent, we have a situation where, simply put, we have the worst air quality anywhere in the country. We have our residents, young and old, being exposed to a particulate matter rate of 2.5, which is the equivalent of every person in the borough smoking some 159 cigarettes per year. We have some 97 people dying each year, and we have amongst the highest number of young people being admitted into hospital. In fact, we've got the highest rate of children being admitted into hospital for asthma-related conditions in the country. And this is in a population where 73% of our resident community is from an ethnic minority, heritage or cultural background. And we have a situation where 1 in 7 of Newham's population and the entire areas of Stratford, East Ham, Forest Gate, Canning Town, these are principal areas where our residents come to shop, but also live around, areas of high density, are exposed to levels of nitrogen dioxide that are above the UK limit value for human health. And the entire borough exceeds the World Health Organization's guide limit for particulates, 2.5 particulates. And as you alluded to, you know, there's been research and there's been evidence. This stuff is not new, it's been well known, but there hasn't simply been the sufficient impact. And since I stepped into office back in 2018, we were really clear that in terms of the determinants of good health and long health, tackling bad polluting air in this borough had to be one of our top priorities, alongside many other local authorities in the country at the time when there was that big galvanising of making declarations left, right, and centre towards the climate emergency. We're already quietly working away with how we were going to be tackling a profoundly disturbing situation here in the borough. We've published our air quality action plan. We've begun to implement, really important programs that redirect car vehicle traffic. Our problem, our challenge as a borough is that we're sandwiched between a range of different boroughs. We're just off the A406. We're used essentially as a rut run for the rest of London. And we need to start stopping motorists thinking that they can use our borough as an easy route through the capital. Engaging with the resident community, simply put, is not particularly straightforward. We have normatized a culture around car use and pivoting and transitioning people around the benefits of a healthy living. Walking, cycling haven't been easy political things to do or practically easy things to do as a local authority, because it also requires us to be rethinking and reconceptualizing sort of the way in which we approach issues of placemaking, and as part of our next stage and phase of our work around this area. We introduced last year emissions-based parking permits, which is causing a bit of a ruckus amongst some residents in our community, particularly car drivers. And we understand that, to galvanise a community around issues of such importance, issues that COVID-19 have very much illuminated, if we do not get to grips with, it will exacerbate issues of disproportionality around health inequality and the risks of getting COVID-19. We're going to need to bring people on in a way that demonstrates active listening, but also an illumination of actually why this is really important, and make that transition in a way that doesn't feel as if it's penalising. And I'm going to just really conclude by ending with, the challenge that faces us all, is a huge, vast and great one. And we are going to need to rethink the way in which we approach notions and ideas of how we live in urban environments. We absolutely do need to contend with the systemic issues of racism and health inequality that hasn't been addressed sufficiently through various government policies and service delivery. We've got to be much more exacting around the things that we commission. We've got to be doing much more education and information awareness about the issue, and we need to be encouraging people to make that transition into more sustainable forms and methods of transport, public transport. We need investment, cycling and walking, but we need to create the conditions that enable that to happen, and we need to create neighbourhoods where people's day-to-day necessities, shopping, accessing the GP, are made easy to access through ease of access by ensuring that we create 15-minute neighbourhoods. So as part of our COVID-19 response, a continuation of our dealing with issues of polluting air that impact on people's lives and young children's lives. We've adopted here in Newham the concept of the 15-minute neighbourhood as part of our additional response to what we're facing. And by way of conclusion, and forgive me, Halima, for taking up a bit too much time, I wanted to end with this as really an illustration of why this is so urgent and important. I talked through some of the statistics about what's facing us. We've got the highest number of children being hospitalised because of asthma. 97 people dying each year because of toxic air pollution. But what that amounts to is this: a young child in Newham, born in 2018, Mel, has 6.5 years less of living than their London average counterpart because of this and other associated health inequality issues. A young female child born in 2018 here in Newham has their life reduced by 3.5 years because of issues including polluting air here in this borough. It's that fact, the reality that a young child's life can be diminished in the way that has been experienced by Rosamund and what happened to Ella, that young children in this borough will have their lives cut short by 6.5 years if you're a boy, 3.5 years if you're a girl, is something that none of us can morally justify, and actually all of us have to mobilise around. Thank you.
Thank you, Rokhsana. Yeah, just there's quite a lot there that we will need to be absorbing, and I think it tallies up with Rosamund's story around the tragic death of Ella, but also the fact that I think you came back to the same themes around children, toxic air quality, and the kind of the risks that children in certain parts of the country face. I would probably say, and I would probably name those children and say, Newham has a disproportionate number of BME communities and children and families, and they're probably disproportionately BME families that are at risk, as Ella was, for example. So we need to constantly remember that that risk is faced differently by BME groups to the environment. And what we're hearing again, I keep hearing that risk word, right? COVID, disproportionate risk, asthma, disproportionate risk. And it's that risk factor that we need to bear in mind, and who it is that's most at risk, and how do we support these groups and protect those groups that are most at risk, that we might come back to. You talked a lot around the kind of comprehensive way in which we might need to rebuild and rebuild back. Sounded a lot like a much better version of the new Green Deal that I hear about. So we're going to come back to that. Thank you. We're now going to go to Nadia Whittome from Nottingham East. Nadia, welcome, and we would love to hear your thoughts and contributions on what you've heard so far.
Thanks so much, Halima. And can everyone hear me okay, by the way, because I'm doing this on dodgy Wi-Fi, so let's hope it holds out. Okay, great. Well, what a privilege to be on this panel, particularly alongside Rosamund, who's campaigning after the death of Ella, has been game-changing and inspiring. And to hear what other cities are doing, particularly in Newham, which I think has to be considered as a blueprint for a Green New Deal in local government across the country. I want to thank UK 100 and Airlie for inviting me to speak this evening. Campaigning for climate and ecological justice is one of my key priorities as an MP. And that issue of air pollution is one that's particularly close to my heart, because I represent another inner city constituency in Nottingham where this is a real problem. Air pollution is, and I've said it in Parliament before, nothing less than a silent public health crisis. It's been described by leading health professionals as the new tobacco. Looking at Nottingham, the Public Health England figures show that 6% of all deaths in Nottingham per year are attributed to man-made air pollution. That's more than 400 people dying prematurely in my city every year because of this man-made problem. To put that in a bit of perspective, it's more than the number of deaths caused by alcohol consumption and road accidents combined. And unsurprisingly, it's disproportionately people of colour who are suffering. I don't think it can be overstated the extent to which this issue intersects with so many other issues like class inequality, racial inequality, and yet how consistently it's ignored. Rosamund has already spoken about coronavirus. Taking that as one example, there's growing evidence around the world that links air pollution to death rates. So studies in the US, in northern Italy, the Netherlands, all found that just a very small increase in pollution exposure raises the number of deaths from COVID. In the UK, there was a study, which I'm sure people have heard about, of over 400 COVID patients. And that study concluded that patients of colour, Black, Asian, minority ethnic patients, are more likely to be admitted to hospital from places where there isn't just household crowding and poor housing quality, which are quite well-known risk factors and exacerbating factors, but also regions with the highest air pollution. And that study also said that this is likely to contribute to higher rates of intensive care admissions among BME patients. So given all of that contextual information, why is it that the government review by Public Health England, looking at disproportionate coronavirus deaths among people of colour, hasn't even considered whether air pollution might be a factor? It's just completely irresponsible and unjust for the government to turn a blind eye to this problem. But moving on to what we can do to tackle air pollution. In Nottingham, I'm proud of the action that Nottingham City Council's taken. So the council here has banned motorists from leaving their engines on while the cars are stationary, invested in a huge fleet of electric and biogas buses, retrofitted diesel buses. But local action isn't enough. We need systemic structural change and proper investment on a national level. And the problem with this government is not only the fact that it's currently wasting tens of billions of pounds on polluting new roads when it should be spending more money on public transport, but it's fundamentally the fact that this government, for all its greenwashing and talking about a Green New Deal and green jobs, it just fundamentally does not believe in that kind of post-war scale investment that we need in green infrastructure that is required to solve this generational crisis. So if we invested in a modern, affordable, environmentally friendly network of public transport, that wouldn't just tackle air pollution, it would improve the lives of hundreds of thousands of people of colour who disproportionately rely on buses and trains to get around. We also, as the mayor for Bristol said earlier, we need to be helping taxi drivers and private hire drivers to decarbonise. That this putting the financial burden on people in society, many of them people of colour, who can least afford it, is not going to tackle this crisis that is being created by multinational, huge polluting corporations. And then again, Black, Asian and minority ethnic communities would benefit not just from that reduced air pollution, but from investment and support to those industries where much of the workforce is people of colour. I'll wind up now because I know we don't have so long, but I'll just finish by saying that all of these examples, and these are just a few examples in the short time that we have, they show how environmental, social and economic justice are all so intricately intertwined and inextricable. So we have to keep pushing the issue of air pollution up the political agenda, from local government, the grassroots, to Parliament and government, until it gets the attention that it deserves and the action that it requires. And frankly, justice for Black, Asian, minority ethnic and working class communities, and we've got to, every single one of us on this call has to build and work towards building a more inclusive and intersectional environmental movement that has not just people of colour in mind, but people of colour leading and at its heart.
Thank you, Nadine. That was also a really great summary of kind of what the challenge we have ahead of us. And what I found particularly poignant is your kind of warning there around placing too much of a burden on individuals who are least likely to have caused the problem in the first place, to then be taking the financial burden and not being able to do so, as Marvin mentioned earlier in Bristol. So moving away from just local action towards systemic structural change would be really important. And those of us who are a little bit older, I count myself as a little bit older, you know, like in the 80s, there was that slogan, you know, think global, act local. It seems as though there's so much pressure to just act local, as though the whole planetary fix is going to materialize from it. We know from this global pandemic that, you know, individual behaviors around protecting us from COVID isn't going to work. We actually need a structured solution to getting out of this crisis. So I think it's similar principles in play here. So we'll come back to that. But I heard that rallying cry there, push up air pollution up the whole agenda, because it's an invisible crisis, public health crisis, but it's also invisible, as Rosamund said. So hold on to those thoughts for a moment. Thank you for that. And we're now going to go to Councillor Waseem Zaffar from Birmingham to hear more about perspectives from Birmingham.
Thank you to UK 100 and other colleagues for organising this very, very important webinar this evening. I want to start by paying tribute to Rosamund. Rosamund, this is the first time I've met you, remotely met you. I just want to say a big thank you for the amazing work that you're doing on the back of such a difficult personal story with Ella's death. And your campaigning, it means so much to us here in Birmingham. And if there is a legacy for Ella, that is that we absolutely need to ensure that we take this matter far more seriously than we have, whether that's local government, whether that's regional government, or whether that's national government. All decision makers need to address this, because we have a public health crisis in air pollution. Here in Birmingham, a city of just over 1 million people, and one of the original motor cities, we are in love with the car. And ultimately, for decades, decision makers have made decisions here in Birmingham which has prioritised private car over other forms of transport. And what that's led to, ultimately, Birmingham in 2021 being a city which is gridlock, a city which is heavily congested in all right across the city, not just in the city centre, but ultimately a city with illegal and unsafe levels of air quality right across the city, particularly within inner city and central Birmingham. So in June this year, we'll be introducing a clean air zone, a government mandated clean air zone, because we were one of the original 6 cities that were mandated from government to get our act together and sort out the illegal and unsafe levels of air quality. And it is the most challenging of clean airs. We're introducing a clean air zone D, which charges all vehicles with the exception of motorbikes. And obviously that has a major impact, not just on communities that live within the proposed clean air zone area, which are some of the most deprived, some of the communities with the high levels of inequalities and large pockets of BAME communities too, but it also has an impact on those that work within our clean air zone area too. But ultimately, it's a crisis and we have to address it. But as Mayor Marvin said, we have to support communities through this, and we've managed to secure nearly £40 million from government to help those communities, and 40% of that, nearly £15 million, is for our taxi community here in Birmingham. And I've got a very interesting relationship with our taxi community. I was once their trade union rep, and if you speak to some of them, I'm now a traitor, but because I'm trying to push this through. And that is partly picking on some of the things that Rokhsana was saying about the challenge we get from communities. There has been a lot of resistance from sections of the community, particularly our taxi community. But I'm a son of a taxi driver, and in early 2009, my father, at the age of 54, suddenly died. And I sometimes look back at that and wonder what the poor levels and illegal and unsafe levels of air quality, how that impacted on his untimely and very early demise. And we know that taxi drivers and bus drivers, because they sit for hours and hours upon it within the day behind their wheel, they are 3 times more likely to be impacted by poor levels of air quality. I also want to touch on how some of the short journeys are also impacting on the gridlock, congestion and air pollution. In Birmingham, pre-COVID, a normal working day would have over 300,000 journeys by car, which are less than 1 mile. So these are journeys to your local school, journeys to your local high street, to your faith institution, to see a mate around the corner. And our real aim now is how we can shift the vast majority of those journeys, because I get there's people with disability and accessibility issues, and we're not going to shift all those journeys onto walking, into cycling and into public transport, but it's how we can shift the vast majority of those particular journeys, particularly journeys to local schools. Because I've got a personal aspiration to ensure that every single school within Birmingham is a safe haven for our children. And I, hand on heart, couldn't honestly say that right now because of poor levels of air quality outside our schools. So, what sort of upbringing are we giving our children who are starting off disadvantaged in our city just because of unsafe levels of air pollution? And in terms of buses, you're absolutely right, Rosamund. The electrification has failed, and I can't wait to see more electric buses. We're in the process of buying 20 hydrogen buses in a deregulated bus market here in Birmingham, but we need zero emission buses as soon as possible. And one of my key aims to see Birmingham, which is, if you know buses in Birmingham, it's the route that goes literally around most of the inner city areas, goes past 300 schools, and the sooner we can get that particular route on zero emission buses, the better it is. But I think coming back to the resistance that we're getting from communities, and it's hugely challenging. And I think there's a direct correlation between some of the resistance we've had with the Clean Air Zone and our campaign to become to have safe levels of air quality, the health inequalities, and also the challenges we're currently getting with COVID. I was speaking to a GP today in Lozells, in my ward, my own GP, and she was telling me that she's already into target group number 4 in terms of vaccinations, because half the people she's phoning in, and the predominantly ethnic minority South Asian background, are turning down the vaccination. And again, we absolutely need to step up the campaign to ensure that more people are taking the vaccination. And this area, unfortunately, has been at the top of the charts when it comes to COVID. Currently, we're somewhere in the region of 1,200 positive COVID cases per 100,000. In the first bit of the lockdown of COVID for Birmingham. So we've got real challenges in getting the message across to the communities, particularly ethnic minority communities, about the importance of ensuring that we tackle these health inequalities, and we do this together and with them rather than to them. And my final point is we have to increase monitoring of air quality, and we have to share that information publicly. And one of the things I want to do is ensure that every school in Birmingham has a monitor of air quality and displayed. So when you walk or cycle or know what the impact of your actions is having on air quality at that particular school. And hopefully, our young people and the school communities will join our campaigns to ensure that we've got not just legal levels of air quality right across Birmingham, but safe levels of air quality in every neighbourhood in our city. Thank you, Chair.
Thank you, Councillor Waseem. That was really, really insightful to hear from Birmingham, and I think you picked up on a lot of the themes that our previous speakers have raised, but also maybe a slightly difficult one as well, around creating the demand from communities of colour towards greener, more inclusive practices, perhaps overcoming that resistance somewhere, and how do we do that better? And I hope we can come back to that a little bit in our Q&As as well. We're going to open up to a few Q&As, but before we do, can I just say thank you very much for all of the contributions, particularly from Rosamund. As we've all said, it's your leadership, it's your campaigning that's shining a light on what has been not only a public health crisis, but a silent one. Air pollution is an invisible killer, and it's your campaigning and your leadership that is shining the light on it. And although it's come through a very painful personal journey, we pay tribute to your voice and everything that you bring here. So thank you for doing that for us. And thank you to the rest of the panel for bringing quite solid contributions to this debate about how we create a lot of political will to kick up, as someone said, air pollution all the way up to the agenda where it needs to be. So I'm going to try and give the audience a little bit of time to send us some questions so that we can have a sort of discursive, dynamic conversation. But to start us off a little bit, I'll just come back, because this is a conversation around air pollution and communities of colour. And as you've just left us with this thought around the vaccines, Councillor Waseem, there is a slight risk there as well that we place undue expectations on communities of colour to take up behaviours, to change, to take the additional burden. They somehow don't come forward, as in the case of vaccinations. But when they are ready, when they can come up to the table to take the action, the infrastructure isn't there, the transition period isn't there, or the processes to enable those communities to take up better action and behaviour isn't quite there. And that's certainly the case for the vaccines, by the way. So yes, there's some reluctance, a lack of confidence, but the rollout is so weak. And at the end of the day, it's BME communities of colour that are disproportionately impacted. So with that in mind, I just want to, ask the question really to start you off. Why is it that communities of colour, and also women, by the way, communities of colour and women are disproportionately impacted, yet they're least likely to have a say on how it is that you create solutions to air pollution, for example? And they might potentially also be blamed for not coming on board by a climate movement that feels very middle class and possibly very white. So any thoughts around how you build that inclusive piece in the movement while enabling communities of colour to feel that actually this affects their lives, it matters, in the way Rosamund is building a coalition. She's doing that perfectly well by herself, by the way, with allies. But what can we do with all the systems and structures that we have to build better connection there so that our communities don't get blamed, A, for not taking the vaccine, B, for not apparently looking after local roads. And remember the Extinction Rebellion stunt in East London, working class communities apparently didn't back that. BME communities didn't back that, but Extinction Rebellion did back it. So what is going on there? So I just want to throw the question back to the panel around how you build communities of colour to a movement that will elevate air pollution way up to the political agenda. So who wants to go first?
Because this is a bit of an emergency, I just really quickly want to just mention the whole thing about vaccine hesitancy.
Yeah.
So there was a report out last year that was meant to be looking into about why Black and Asian people are more likely to die from COVID. And I don't really know what happened to that report. It didn't go into detail. It didn't really address the issue. But we are where we are now. We do not have time because basically Black and Asians, is it 4 or 5 times more likely to die from COVID?
Correct.
So we have a problem, and it's a problem now. So we need to look, we know that our communities will feel better or more secure going to their GP. We know that for a fact. They're not going to go to these centres. We know that. This is not a secret. There needs to be a campaign really quickly. And also, we got messages that the Queen and the Duke of Edinburgh and David Attenborough have had the vaccine. I haven't seen anyone who is in the age group of 80 or 70 plus coming forward from the Black or Asian community that has had the vaccine. And we have to admit, there have been numerous messages, and I know everyone's seen them on social media. I don't know whether it's been targeted to our community. I don't want to make claims of that, but we've seen a lot of things about vaccine and whether we are being used as experiments. And these messages, unfortunately, they are going in. But I don't think we really got time to have like long debates when people are dying and people are very ill. So someone higher up somewhere needs to decide very, very quickly what they are going to do about this issue. This isn't one of those that we can sit there and debate whilst more and more people are being admitted to hospital. So it's called, I think I read up on it, it's called vaccine hesitancy. So I mean, I have some ideas, but it needs to be addressed now. I know that's separate from the air pollution thing, but I just had to say that about the vaccine, because apparently Mayor Khan did a survey amongst Black and Asian people across all ages, so from young all the way up to older people, and 73% of them said they are not going to, or they're concerned, or they are not going to be taking the vaccine. So someone needs to come up with a strategy very, very quickly.
Rosamund, just wearing my Runnymede Trust hat, trust me that there's massive campaigns happening between now and the next 3 days to boost the vaccination campaign, to say yes to the campaign and to understand the reasons for the skepticism in our communities, but also to ask the government to roll out the vaccination faster in some areas and put the vaccine where our communities trust it, in the hands of the GP, not the massive Excel centres that are next door to Nightingale or other places where there's COVID treatment going on. So fundamentally, I mean, this is related. Where is the greatest level of trust in our communities of colour, where they need the services and support? Okay, these are communities that have lost confidence in systems. They've lost confidence in the public health system, lost confidence in the hospitals. That would apply for air pollution as well. So I think there is a very significant agenda around building confidence in communities of colour, whether that's for air pollution, whether that's for taking the vaccines, whether that's in the criminal justice system, it all applies. So I actually do think it's linked. So thank you for bringing that conversation back on the table. So how do we build that confidence and that inclusion from communities of colour on issues and a crisis point that affects us disproportionately and more so? Rokhsana, Mayor Rokhsana.
Thank you very much. So look, in the Newham context, and I've noted some of the commentary or questions in the chat as well. In the Newham context, the reality is this: the vast majority of our population actually don't own cars. 58% of our resident population don't own cars, and one of the most heated debates at the moment taking place locally comes on the back of a full council decision that we passed last year to deal with both the air quality crisis facing our population and the climate emergency declaration that we made. And we introduced emissions-based parking, which kicked in and came in live on the 6th of January. Obviously, when it was passed, no one could anticipate a COVID-19 global pandemic that has indelibly kind of changed sort of how we live presently. But we know this, that the conversations with ethnic minority communities about these and associated matters needs to be heavily participatory, it needs to be non-stigmatizing, it needs to be involving, and we've adopted a raft of of approaches and methods predicated on, you know, co-production, co-design, our participatory democracy agenda to involve them in, number one, understanding the full range of issues. So last year we also established a citizen assembly, you know, where residents were drawn based on the sortition method to look at a whole range of issues pertaining to the climate emergency, including air quality. And one of the high-ranking areas that they wanted us to address was the issue of air quality. Conversely, fast forward to now, I have a number of car drivers that are finding the emissions-based parking scheme, which basically replaces a pre-existing scheme where car drivers were given a free parking permit, despite the fact that they represent the minority of vehicle, you know, they represent a minority, i.e. a majority of people in the borough don't own a vehicle, yet they are providing a concession to car owners by virtue of them being given a free parking permit. So we've introduced an emissions-based parking scheme, electric hybrid cars free, and then based on the emissions output, you are charged a particular tier. We've introduced a 20% reduction. We're looking at other measures that we can implement to make it easy during this period where we know that similarly families have been hardest hit. And then just picking up quickly, just by way of conclusion, there was a question about, we've got a number of Uber drivers who are insecure jobs. We've actually got the highest number of Uber drivers anywhere in the capital that are registered in Newham, and they work from Newham. And the issue of insecurity actually needs to be a challenge that we take to the likes of Uber to stop exploiting our residents and London's workers, to provide them the security of a job and a livelihood and an income that is decent and fit for purpose for the 21st century, and enables them to be able to cover their requirements in terms of living. And obviously, there's a wider piece that all local authorities are addressing in terms of the economic impact of COVID-19, which has been addressed in a whole raft of different measures through, a number of things that we're doing to support businesses, self-employed entrepreneurs, as well as the resource and efforts that we've put in to help those households that are suffering significantly because of income reduction as a consequence of, the impact of lockdown and the economic impact of COVID-19.
Thank you, Mayor Rokhsana. I'm going to let maybe one of the other panel members come in and just sort of answer this question generally before I have some specific questions from the audience as well. So does anybody else want to provide comments before I get some probing questions from the audience? Is anybody's hand up? Got very shy panelists, or maybe panelists that like to listen. Okay, so I've got a question from the audience. Geraint Davis MP for Swansea East. He's the chair of this APPG on air pollution. Nice to see you here, Geraint. You would be in the audience, of course. Does the panel agree, given that poorer communities of colour have the worst outcomes from air pollution due to all sorts of structural reasons, for example, do we need something like the WHO legally binding air quality limits and maybe a cross-government duty to tackle air pollution in the Environment Bill on Tuesday? So it's a very legalese question, but it's a very important one given the timing. So can somebody who'd like to answer that one?
Sorry, Nadia and I did put our hands up. I don't know if you can't see us on the screen.
Oh, I couldn't, go for it, Marvin.
Well,
yes.
we were both putting our hands up just now. So.
There you go. So you first.
You go, Nadia.
No, you go, Marvin.
We'll take the highest standards possible, right? But you've got to send some money with it. That's the bottom line. I go to gatherings, I'm sure Rokhsana does as well, where we get mayors in a room and we tell each other stories about what we've done within our cities, and there are fantastic stories. But the first question I then ask is, well, how much did it cost? Right? C40 recently put out a list picking out the key themes of world-class cities on climate change. All of those had mass transit systems. Well, to introduce a mass transit system in Bristol cost over £4 billion. Now, we're doing the work on that, but we have no bankable partnership with government that give us the certainty that this thing that everyone around the world says you should do, we're on that journey with you. Our relationship with government is someone sits behind a desk with an Excel sheet and we see if we've met the criteria, rather than them coming upstream with us and saying, let's work with you to deliver this thing. So we've got no certainty on that. It's just not it's not a partnership relationship. Many of the things talked about we've done. We've introduced 100 biogas buses to Bristol, the largest single order of biogas buses. Now, fair play to, I think it was Kit Malthouse when he was in role. We said, actually, well, why don't you work with a whole collection of cities so that rather than us each buying 100 biogas buses here or 20 electric buses there, work with us as government, set a framework where you get 20 cities together, and between us, we buy 5,000 buses in one go and benefit from economies of scale. Well, that work started, but hasn't continued. He moved on to a different brief, but he was looking at that. Now, that's the kind of thing government should be doing, working with cities to enable it to happen. we are not lacking ideas, and we are not lacking descriptions of best practice. What we are lacking is the finance to deliver it. I'm on a board now with the World Economic Forum, a Future Cities board, with mayors and World Bank type people, and Greg Clark, not the minister, but the big thinker on world cities from all around the world. That piece, and the one I'm on, is municipal finance, right? And it is trying to think, how are we going to get hold of the 10, 15, 20-year financial vehicle that will accompany us as cities on the reconceptualization of, replanning, and then rebuilding of our cities? Because we cannot take a patch and mend approach to transport and decarbonisation and cleaning up our air. It takes rebuilding our cities and fundamentally changing the systems that underpin city life. So just my final example, and I'll show. When people get on one of our biogas buses, they don't get on the bus necessarily thinking, oh God, I'm doing my bit to transform air quality. We've set up a transport system that they don't have to think about, that is decarbonised and is biogas. That's what we need to do around transport, around housing, around waste management, around cleaning our water supply, our energy supply as well. Individual actions and lifestyles are good, but the way our cities have grown over the last decades is with no regard to planetary limits or air quality. Now we know we need to change that. And at the beginning of this decade for action, we need to take this opportunity to say, well, we need to get the economy going again. Let's rebuild our cities, right? And so that one is we are driving the economy forward, but we are putting in place systems so that when the economy does start moving again, it's not killing people and killing the planet. To me, it's we just need that kind of long-term thinking from government. Unfortunately, we're not getting that as a whole. There are individual politicians in government that perhaps would think like that, but I certainly, as a city leader, I'm not on the receiving end of that kind of long-term thinking that we need. And we do have an emergency today. We need to take action today, but also they say the best time to plant a tree was 40 years ago. The second best time is today. We didn't do the work we should have done decades ago. We need to start doing it now.
Thank you, Mayor Marvin. And before I come to Nadia, just quickly, we had a comment from Polly Billington in the audience who's saying, congratulations to Bristol for biting the bullet and introducing the charging zone in the city of Bristol. Like, well done for that. But then obviously a question with that, what measures will there be in place to support residents and businesses? Very often these are BME businesses as well, to manage the impacts of that clean air zone.
Well, and Waseem probably well to talk to that, because we looked at, I think there's quite a good collection of mitigations that were put in around the clean air zone in Birmingham. Look, again, our point from the beginning on the clean air journey was we need to introduce it, but clean air kills people, poverty kills people. And what we need is that comprehensive package. So for us, we're yet to put in the outline business case to government in February cabinet, and then we'll work with JACU over the summer to agree to mitigations. But we'll want someone to help. We'll want some money to help people transition their cars. If you have a middle class movement where someone who just says, well, I'll just go and buy an electric car, that's not people on low incomes. As the phenomenal number of comments under the local papers post of that story has angry people saying, how am I going to afford this? Care workers, right? Employed plumbers, taxi drivers will say. So for us, it has to be about mitigations. It has to be about transition periods. It has to be overt financial help, and all the rest of it. We've got to help people through it. Otherwise, we may get a short-term hit of popularity amongst some people who are on Twitter. But what we've just done is we've potentially lost many elements of the population, and lost in the course of not taking account of poverty, the democratic mandate for introducing the scale of change at the pace we need to introduce it. So we cannot go at the pace of the slowest, but we have to take people with us, and we should be concerned about poverty anyway.
Absolutely. I'm just going to check. I know, Nadia, is your comment related to this point, or with Nadia? You had your hand up.
Yeah, I've got quite a few as the conversation has progressed, but I did want to also pick up on the points around how we make this inclusive. I think it's really important for people and communities of colour not to be characterised as being resistant to radical environmental change. That's just not the case. We know that, as we've already explored on the panel, in this country, but also all around the world in the global south, it's people of colour who disproportionately bear the burden of the climate crisis and did the least to bring it about. But of course, there is a perceived tension, and sometimes it's a real tension because it depends on how policy is enacted between jobs and the environment. There doesn't need to be, but sometimes there is when workers are made to foot the bill for the systemic change that we need. So I think we need to look at the climate crisis in an intersectional way, through an intersectional lens, as being a workers' rights issue and a racial justice issue. So take, for example, one of the things that we've done in Nottingham, delivery drivers went on strike over this new metric that Deliveroo introduced, which basically prioritised car couriers over cyclists, and most couriers are cyclists. So that was something that not only harmed the environment, but also harmed workers' rights. And we were able to get a critical mass of taxi drivers and Deliveroo riders standing together against Deliveroo's exploitation of workers and also the planet. And I think that we should be looking through legislation about how we can empower workers to take that kind of industrial and direct action in response to bosses' exploitation. And as Rokhsana said, and Marvin mentioned as well, we need to have a proper democratic, deliberative and participatory process. So things aren't being done to communities, but they're being decided and done by communities. I did want to say a little bit about local government, because this is really important, and Marvin put this very well, and I've noticed a few questions in the chat as well that pertain to this, that local government is really important and has a very important role to play. I really liked what you said from the 80s, Halima, about thinking globally, acting locally. And I think it's important to celebrate the wins of local government, but we've also got to bear in mind that, just speaking about Nottingham here, but it's the same for councils across the country, particularly city councils, that today our council has started its budget consultation with over 15 million cuts proposed, and that's due to government underfunding and government cuts since 2010. So yes, we need radical ideas that meet the challenge at hand, but they need to be followed by the money. And that goes back to what I said in my opening remarks about the Tories just fundamentally do not believe in investment, and that's where a lot of the problem lies.
Thank you, Nadia. So I think you've raised that general issue around political will at the moment. You know, you could have the best evidence, the best data. Where's the political will? And it's very, very small at the moment. I can see Rosamund's hands up. Go for it, Rosamund. And then Waseem after you. That's okay.
Well, the question was about the environment bill, which is massive. It's coming back on Tuesday. So we've got a very small window now to influence this bill, and it's something we can actually do. We need to take some action now, which will have long-term benefits. So there are two amendments, and the one we've mentioned, the WHO limits or targets, and it's been tabled by Neil Parish. And I notice on here there's over 100 people So if everybody could send a quick email, this is proper action, to the MP to to support the amendment that Mr. Parrott is putting forward, that would also help. That this is something we can actually do in the short term. And if you tell your friends and your families and things like that, because we need to have these targets enshrined in law. It is very late in the day now, to be. This is my whole issue with the whole thing. That I bet you majority of the public, if you go out, if they're not campaigners, and you say to them, "What's the WHO targets or limits?" they won't have a clue what people are talking about. And there goes the issue, I am afraid. But those of us here that are engaged, maybe there's 150 of us. We can all email our MPs and ask them to support the amendment. And that is proper immediate action being done now. And people always ask me when I go on these things, what action can I take immediately, or I want to make a difference? I say to them, stop idling. No matter where you are. I saw people in car parks in vaccine centres. I know they're going to get their vaccine. They were idling. I thought, oh, goodness me, here we go again. Switch your engine off. Stop idling. It's against the law, and that's something everyone can do. So email your MP tomorrow. What's tomorrow? God, I'm forgetting days. Thursday, I think. And give them a chance to read your email and ask them to support the amendment. So that's real action we can actually do. A lot of things we're talking about is more in the long term, but this bill is happening on Tuesday, and we need to take action. It is within our power to take action. We can't always rely on people to do things for us. So please urge as many people as possible, because if MPs are suddenly bombarded by lots of emails for them to support things, they're going to think, what is going on here? Whereas that we don't have long, because it's happening on Tuesday, and then it goes off to the House, the House of Lords. So please do that. If there's one thing you want to do that, please.
Thank you, Rosamund. That was very loud and clear, because it's a simple piece of action that will have long-term impact and change the legislation. So thank you, Garrett, for actually asking that question and focusing our minds. So thank you for that.
I forgot to answer that when I came in. That was one of the things that I wanted to come back on. Sorry, Grant. I absolutely agree, and I know that Labour fought to get this into the Environment Bill and also the Brexit deal agreement last year, and this is something that we need to keep fighting for.
Excellent, thank you. Well, look, I'm going to ask a slightly different question now, because we're talking about air pollution and children. Okay, schools. Councillor Waseem, what more can national government do to enable you at local government level to help, clean the air around the school buildings? And I'm losing count of how many new school buildings are propping up, new academies, always in the high street and in a congested part of town, which is harming our children. That's another debate altogether around academies. But what can we do to enable you to clean the air around our schools?
Halima, I'm going to answer that question, but just to come back to what Mayor Marvin said around support for businesses and support for the wider community when it comes to a charging clean air zone. We're introducing a charging clean air zone in June, and when government asked us to do this, we said very clearly, the whole aim of this is to reduce air pollution, reverse health inequalities, but we know that if a charging clean air zone means people lose their jobs and come out the labour market, that's going to have a detrimental impact on their health and well-being too. So it's really important we get the right level of support. So we've agreed a series of exemptions, a 2-year exemption for those that live within the clean air zone area. Particularly, that's really important for those communities who are probably the most deprived in Birmingham, that live within that particular patch. A 12-month exemption for those earning less than 30,000 or working within the clean air zone. But importantly, £2,000 for them if they scrap their non-compliant vehicle and buy a compliant vehicle. That's for those earning less than 30,000. And also support for taxi drivers up to £5,000 to help them get compliant vehicles and zero emission vehicles too. So there's a lot of support, which is, we had a really challenging consultation, the biggest that the council's ever done. but a lot of the vast majority of people were against the clean air zone. But the key thing that we got out of that particular consultation was what support people need. And we've worked with community groups, we've worked with the local Chamber of Commerce to co-design those mitigations and exemptions to support people through what will without doubt be a very challenging exercise. In terms of schools, you know, I want to ensure that our streets are a lot safer. Last March, I wrote to the Transport Secretary asking if Birmingham can become a default 20-mile-per-hour city. That would have turned 90% of our roads, the residential roads within Birmingham, 20 mile per hour overnight. You know, they can do it in Scotland, they've done it in Wales. But yet we can't do it in Birmingham. We have to go through phases, which, you know, costs millions and millions of pounds. And unfortunately, the Transport Secretary rejected that. The school street project is brilliant. We've got 12 school streets within Birmingham. 11 of them have worked really, really well. The one that hasn't, that contradicted with the controlled parking zone. So we're working on that. But ultimately, we need the resources. It goes back to what Marvin said. You know, you can change legislation, you can change regulations. They're really important. But give us the money to do it. And in particular, you know, we'd love in places like Bristol and Birmingham and Nottingham to have the level of investment that goes into the capital from the government into transport, because we get less than half per person per year compared to what the capital gets. So if we can rebalance the relationship between the funding, that is going to be vital. And, you know, we've used money really, really well when it comes to active travel. We've not only put up pop-up cycle lanes and our famous blue segregated cycle lanes, but we've also given out 7,000 free bikes to the communities that need them. You know, you can't tell communities to go and cycle if you've got a mother and father and 4 kids and yet they're on the minimum wage or the living wage. You need to give them the support, the infrastructure, and through the cycles that we've given out, through the community cycling hubs we've set up, they can access those facilities to get out there, but we need the money.
Yeah, I think everybody's in agreement with that one. You know, do not devolve the power without the money, because then you get blamed for not doing the right thing. So definitely we need to see the resource transfer. And I suppose we need to see the big money and the big investment to see the changes. I'm just going to turn to Rokhsana for the moment. I mean, is that the same situation in London and Newham, or are you seeing a different scenario, Rokhsana?
Sorry, what was the last part of that question?
Around, you know, what more can national government do to enable you to clean the air around the schools where the majority of our children are congregating and breathing toxic air, for example? So I've related it a little bit back to children and air pollution, local inability to cope because the national government isn't transferring the power, but we're also hearing not enough resources as well.
So we've introduced a network across the majority, in fact, all of our schools. We've installed air quality monitors outside all of our secondary and primary schools in order to collect data so that we can track both the challenge, the scale, and also the impact of our interventions. And that's an important dimension of the ongoing conversation that we need to have with resident communities. You don't have one or a few conversations from the outset, you actually take them as part of your journey. We've also introduced across all of our primary schools safe school streets programs whereby traffic is moderated and stopped during those critical going to school and coming home from school times, but also we're introducing and complementing that with low traffic neighbourhood schemes, which I know are controversial or people have different views about them. But you know, where we've run a pilot in one part of the borough, which literally I remember vividly, and it would be one of those things that I'll never forget. So when I was campaigning to get elected to become the mayor of Newham, there was a stretch of roads that came off of one of our major high streets, but it was being used as a rat run. And it was kind of like the equivalent of about 8,000 cars, between 8 to 10,000 cars driving through these small residential streets between the hours of 8 o'clock in the morning to 10 o'clock at night. And we introduced a traffic calming pilot, which closed off the bridge that allowed all of this traffic to come through. And there's been a massive reduction. And whilst one part of the community has been really unhappy that their ease of access to the rest of the borough has been frustrated and they have to go through the major trunk roads and it adds a bit more time to their journeys, actually the health impact in the part of the borough where air quality issues are so pronounced has been transformative. So it's using that as an example of saying, actually, these are the reasons why we're doing it, because ultimately, as Rosamund can attest, we are on the right side of history on this stuff. And then I would also just really concur with, you know, the things that Marvin has said around, actually we need to be drawing down more of that, you know, capital money, that money from government, and you know, to allow them to enable us to be innovative in this stuff. So, you know, we've got an aspiration, you know, like Marvin in Bristol, to be the drivers and the hub of kind of, you know, the Green New Deal, the green, you know, green economy. And everyone talks about, you know, there needs to be an appropriate transition, but that transition also has to be a just transition, because people are going to be impacted, and that is, you know, the most polluting industry sectors, but also people that are driving cars, and we've got to engage with them in a way that demonstrates the value and the right side of history on this stuff, and recognizing and appreciating the, you know, yes, they will be feeling aggrieved by what we are doing, but we will help alleviate that sense of grievance. But ultimately, where we want to all get to is going to benefit them, as well as, you know, that specific cohort who in health terms we're trying to protect.
Could I kindly ask you, where are you regarding the ultra low emission zone? Is it coming to your neighbourhood? Are you in support of it?
Yeah, I mean, it's so that
it's not.
Yeah, the ULEZ, we're going to be impacted by ULEZ because it's a determination that the Mayor of London has instituted. The added issue that we've got, so the way in which Newham emerged as a borough, we're surrounded in part by the A406 that takes people on to the north, the A406 North Circular. And then we are also a major thoroughfare from one part of the city to another part of the city. And then we have the issue of being the only London borough with a London postcode with an airport. We've got City Airport. And then we're going to have the Silvertown Tunnel. And I've seen some commentary about the Silvertown Tunnel, and I will continue to advocate against the Silvertown Tunnel, which is something that I've been doing consistently.
Thank you.
Are you supporting the zone?
No. I'm opposed to. I'm opposed to the Silvertown Tunnel.
No, I'm talking about the ultra low emission zone, because I was going to call for it to be London, the ultra low emission zone. Are you supporting that?
Yeah, I'm supportive of it. I'm saying that we are captured by it as well. I'm not in opposition to it, because I think it's important as part of our move towards the sustainable transport requirement and vision for London. So the Mayor of London set a really clear target by 2042. 80% of transport modality should be walking and cycling. And as Marvin has said, that requires us to think in visionary terms and, you know, about how we live in an urban global city environment, you know, context. That means, you know, livable neighborhoods that enable us to be healthy and happy, where we've got ease of access to all the things that we need. And so, you know, part of our plans evoke that idea that's been instituted in Paris, the 15-minute neighborhood concept, which has taken the world by storm. And then, you know, the stuff that Marvin's done, you know, reflects things that the Mayor of London, Sadiq, has done as well.
Okay.
Thank you. I'm just looking at the time, everybody, because I think we're due to finish at 7:30. But we have a question before we wrap up. We have a question from Virendra Sharma, Labour MP. Virendra, can you hear us? You want to ask the question quickly, and then we'll let the panel answer the question. We need to unmute Virendra. Okay. Say, back room, you need to unmute Virendra. Okay. Okay, so look, while we get Virendra Sharma to come and ask the question, I think what's very clear at the moment is that, you know, you've got all the best data possible, you've got maybe all the delegated powers possible, Marvin, but what's really missing is a resource and the money. But even with that, we've had a question from the audience to say, look, we have known what the action is, we know more needs to be done, there's been a lack of political will. We have seen how Rosamund has used the death of Ella to just really shine the light on what this means in human terms, what toll it takes at local level on our families. So what more can we do to get the decision makers, the managers, the other mayors, not these mayors that we have with us, to do more to elevate air pollution as a kind of silent crisis that's affecting all of our communities? So if you had one action, call to action beyond, you know, engage with the Environment Bill on Tuesday, Rosamund, what else would you encourage everybody to do? You've got about 100 people listening in today. So what one thing would you encourage them to do? So I'll go to Rosamund first, and if you all go around, we can wrap up.
Stop idling. That's a very simple ask, and I hope mayors and people like that will push it, because especially outside school, especially during COVID times, terrible idea, and it needs to be taken seriously. I know apparently in some boroughs they sort of warn you, then they do this. No, I don't know whether it needs to go in the highway code or something. I'm not quite sure. Idling increases air pollution in that area by 50%. So I am all about now what people can actually do during COVID because of so many things. So definitely stop idling. That's my big ask right now, because it is winter season and asthmatics generally struggle during winter. So I think stop idling is don't idle, switch off your engine. That's more than enough for me, I think.
Great. Practical suggestion. I'm going to go over to Mayor Marvin. What one thing would you want to do or get decision makers to do to accelerate action on air pollution?
That's too difficult. Say one thing. As a mayor, we think about 101 things. Put some money on the table, real money. You could do deals with city regions to travel to work areas that have plans accompanied by the money to deliver those plans. Can I just push back gently though? The argument about all it takes is political will. Maybe in some forms there's a lack of political will, but the absence, political will alone is not enough. Stuff needs to get paid for. If political will was enough, we'd have ended racism and sexism in the city. The moral argument is never enough in and of itself. And the same on air quality. It literally is about delivery.
Yep. So money, political will, and resources. So that's 3 practical actions. By the way, we've not ended racism on the streets. I just wanted to say that, even with all the best political will.
And my political will's for it to end it, but it takes more than that.
Yeah, no, sorry. I did say we've got some of the best mayors with us today. We are talking about the other leaders. Same question to Waseem.
So without repeating what Marvin said, the one thing I'd request the average citizen, please try and walk your children to and from school. I think that very simple ask of you, if you're able to do it, will make a massive change to air quality levels outside school and also benefit your mental and physical well-being as well.
Anything for decision makers, Waseem? So this was action for the public. Anything towards people with power that they need to do?
Give us the resources. This is a public health crisis. It's an emergency. Give us the resources to make the change. Charging zones, it's a start. I want safe neighborhoods. I want to go past that 40 milligrams per cubic meter of, the WHO target for NOx levels. I want to get to real safe levels in every single neighborhood in our city and right across the country. And to do that, we need a drastic change in the way that people and goods are moved across the city. But we need infrastructure change too. Otherwise, it's not going to happen.
Thank you. Same question to Nadia.
Thanks. I'll repeat what I said before. We need a post-war scale investment in green infrastructure and green jobs. One really small start to that could be redirecting the 27 billion that is due to be spent on new polluting roads and using that to build sustainable transport systems and networks. I'd say in terms of takeaways for people watching, organise, that's my answer to everything, but also ask questions locally and nationally, ask questions of the council, of businesses, of politicians, ask them, what are you doing about poor air quality? How are you protecting and safeguarding communities? What equalities impacts assessments have you conducted? And what are your regeneration solutions to these problems? What is the timeline? Try to get those concrete answers from decision makers. And then just lastly, I'd echo the calls of everyone else on this call that local government needs to be properly funded to put these things into action.
Thank you, Nadia.
Can I just say on Tuesday, we are watching the MPs, how they vote. They all keep on saying clean air quality. We are watching on Tuesday. It'll be really interesting to see how they vote, because now more and more people are beginning to understand about air pollution. So we are watching them.
We see you, Rosamund, as we say, we see you. So we'll be watching the votes. Thank you for that reminder for the votes. Mayor Rokhsana, what's one, actually, a few things that you would do?
Oh gosh, right. Do you know what? I'm going to just make it easy for everyone because I appreciate it's been a long session, but I endorse everything that Nadia, Rosamund and Marvin have said, even though on one level they may come across as slightly contradictory, but also the great stuff that Waseem's doing over in Birmingham. It's just carrying the intention to build, you know, a social movement on these issues and mobilising all the activists. I mean, we're doing some really, really important work by, you know, with our health partners, and they've built in, you know, this area of our work has been quite fundamental and critical to their required outputs and their commissioning. So it's about having that whole systems approach at a local level as well.
Brilliant. Well, thank you so much. I think we've all learned so much from hearing from you all, taking in questions from the audience. There's never enough time really to delve into some of these critical issues, but I can see that this is an evening event, and judging by the strength of numbers in the audience, there's significant passion, care, public will out there, and maybe even some political will in the Houses of Parliament to get more action done. So I'd like to close this seminar by saying thank you for bringing all of your insights in. Thank you, Rosamund. Thank you, Nadia. Thank you, Mayor Marvin. Thank you, Waseem. Thank you, Mayor Rokhsana, for shedding light on this issue. And it's just, you know, it's just the beginning of a very difficult conversation to elevate air pollution as a public health crisis and an emergency. And if we can't do that during COVID, where there's a lot of concern around breathing clean air, how we breathe, how we behave, how we look at our mental health being, when are we going to do it? So I think it is a really, really important point and a crossroads in how we elevate this campaign further, Rosamund. So thank you all of us for joining. And I wanted to say thank you to our supporters once again, because they're behind the scenes. UK 100, thank you very much for organising this event with Airly and the APPG on air pollution and the Clean Air Fund and the European Climate Foundation. Thank you. And it's not the end of the conversation. We'll see you soon again. Thank you.